Hi there, it's Dr. Greg Gorman. I have another in my series of videos about things you'll see in clinical practice that you didn't learn about in school. So today I want to talk about one that, it's a couple different variations of the same theme, but I get people who kind of are skeptics and they're coming in for a variety of reasons, sometimes because their spouse is haranguing them to come in or it's a parent and the children are after them to take care of themselves. But I also will get sometimes people who are looking for active release technique but don't want chiropractic. Now, I'll talk about that one first because that's a little bit easier issue to deal with. So the way active release is taught, it's taught as a standalone therapy, which it is. And I certainly don't mean to throw any disrespect at people that just do ART, but I'm a chiropractor, right? So I want to do chiropractic, and I love doing the ART in conjunction with the chiropractic. That's the way it was always. I was always going to do it. But what happened is I did my ART modules through most of 1999. And I got certified right away in spine, and then I did upper and lower extremity in the early part of 2000. And I was really the only doctor in the Boston area that was doing ART. I think there was someone in southern Maine, maybe someone out in Framingham, Massachusetts. But it basically was me in Boston. So I got a ton of referrals, which was great. But what would frequently happen is people would call and not want chiropractic. They want ART and they didn't want to deal with chiropractors. So I thought that was kind of a curious, it was kind of curious to me. I understand it. I mean, I get where they're coming from. There's a tremendous amount of bias in the medical community, sometimes in the fitness community, and just in general in the media, we're kind of portrayed as these quacks that people don't quite know how to deal with, but sometimes we're effective. And, it just, it really kind of drained me the first couple of years in practice. And what the tack I would take with these people initially was I thought, oh, good, they should come in and I'll show them that I'm awesome. And then they'll want the chiropractic because I'll talk to them about it. So that's what I did. And pretty much not very successfully. People, occasionally, I could think of a couple people who didn't really have a strong opinion about chiropractic, but they weren't really thinking about it, but they were really thinking about the ART. And when I explained to them the proprioceptive reflexes in the spine, what a chronic subluxation does to the biomechanics and then in turn to the musculature, they would get it, and then they would become chiropractic patients, which I loved. But I'd say that was probably 5% of them. The vast majority of them, they had their mind made up. They kind of didn't care. They wanted something from me, and I would do it, but then not feel very good about it. I just did not like it. So when I moved to San Francisco, I worked with a friend who is also an ART doctor, and he would always see those patients. You'd always see it. Now, and I needed the money when I moved here. I didn't have anything. I came here with money in the bank, and that was it. So I had to market myself and start a practice, and I certainly wasn't going to be turning away paying customers, especially if they're paying customers that kind of don't want me to do a big part of what I do, because I'll still charge them the same amount of money. And then, you need the money when you're new. But it always kind of stuck a little bit in my head. It turned into a little bit of a mind trap because I would be a little bit prone to sometimes feeling like, oh my gosh, what am I doing with people? Am I doing enough? Am I doing it right? Am I good enough? Am I helping people? I'm taking their money. I charge a lot of money. I've always charged a lot of money. And I would feel sometimes like, oh my gosh, I'm a fraud, and I think that a lot of us go through that. A lot of us go through that. And the people that say they never go through that, I think I don't necessarily buy it. Or maybe we're just using different language, because I think this is just part of the human condition. You're going to sometimes feel insecure. You're going to feel sometimes like you don't know what to do or don't know what you're doing. And these type of patients can really trigger that, is what I found. So my tack now, if anybody calls me and says, I would like ART or I would like craniosacral therapy, but I don't want chiropractic, I say, let me refer you to someone else because I'm a chiropractor. Now I don't argue and I don't make them wrong, and I also I don't make a big deal out of it, but I definitely refer them out. It just isn't worth it to me. You may feel differently, and by all means, treat them. You can help them, but I felt like I was just doing them a disservice, and then I just didn't feel good about it because I take it a little bit personally. Here I'm making all these videos, I'm telling you don't take things personally, and I'm taking stuff personally. So learn from this, because it would just be, they're not. The patients aren't being aggressive usually. They're usually polite and they're nice, but they don't believe in what I'm doing, and that just kind of bugs me. So I know that that will bug me. So I don't put myself in a position where I can get into that mind trap where I start questioning myself, or, because God forbid you adjust them and then they feel worse afterwards, which sometimes can happen. It just that can then become much more tricky. So there's that type of patient. And then the other type is interesting. And I'm going to have to talk about gender roles here, and I'm going to do it with some stereotypes. So please forgive me because it's just too hard otherwise. So I would say that historically, and I learned this in school, that we're going to have just slightly more women in our practice than men. And I think part of that is that it's a little bit more socially acceptable for women to ask for help than it is for guys. And what I find is that I will get a spouse in, and the gender doesn't necessarily matter, but it usually is a woman, and they're usually referring their husband in. And the husband's one of those, like, I'm going to pull myself up by my bootstraps and take care of this myself. And then things don't work. You can't do that with your body. You can try, and sometimes it works, but mostly it's not going to. So they end up needing a chiropractor, and their spouse loves you, and the spouse knows all the good things you can do for them. So they harangue them until they come in, and they kind of resent it, and they don't want to come in. And you can totally feel that the minute they walk through the door. And they're going to be always just a little bit skeptical of what you do, and if it doesn't go in exactly the way they think it's going to do, they won't come back. So this is pretty much consistent throughout my years of practice. People get really enthusiastic about the work I do, which is really awesome. And then they want their friends, their family, and their loved ones to come in. But people don't want to be harangued, especially harangued into going to the chiropractor. So they come in and they have these preconceived notions, or they're just, kind of not, it's not going to work. So they're, being negative. And sometimes if you think a treatment's not going to work that you're receiving, it probably won't. And I always would think like, oh, I'll convert them, I'll be awesome, and they'll see. And sometimes that is absolutely the case. But I don't put a lot of energy into that anymore because they're going to do what they're going to do. And I just try to be awesome and try to communicate as much as I possibly can. But I don't put a lot of energy into getting them to have the same type of relationship with me that the person that referred them in has. Occasionally that'll happen. I've had spouses come in and they become really cherished patients of mine who come in for years and years when they have needs, and that can be really awesome. But sometimes it's one or two sessions and they're not liking it or they're not getting what they need and they are done. So in beginning of practice, that would really kind of bug me. I'd feel like I failed, like I didn't get through to them. And I'm just here to say, let it go. It's not about you. It's about the personalities of the people coming in. And it's about the media and the amount of negative information and the amount of misinformation about what we do that's out there. But it's also just about people and who they are. So I would encourage you, as in all of these videos, don't take it personally. Just don't. It's not worth it. And it becomes a real drag on your day when that happens. So, if you're sensing on the phone when you're chatting with these people that they're going to be one of those types that might drain you, you don't have to accept them as a patient. You can refer them to someone else. Or you can say, I'm sorry, it doesn't really sound like I can help you, which I very rarely do. But I just want to say that, that's perfectly appropriate. Because the last thing that you want to do is be drained during your day. You need to be happy and perky and excited and enthusiastic, and it takes work to be that. And if you've got outside stuff kind of like at your head that is making it harder for you to be happy and enthusiastic, it's going to affect your practice. So take care of yourself in these situations. Don't take things personally. Be mindful. But I'll tell you this: if this is resonating with you and you're feeling like I'm talking about stuff that you do, let me help you. I learned a lot about I learned a lot through the mistakes that I've made. And I suspect that you're all probably making some of the same mistakes that I did when I was in my early career. Uh, and I was lucky that I had a mentor, and he kind of, gently nudged me in certain directions so that I would not, I would have a better frame of mind, or I would trust and believe in myself more. But we don't have that when we're alone in clinical practice. Let me be that for you. I'm coaching, I'm mentoring, and I can help you. So give me a call.